Queensland Health is postponing some non-urgent elective procedures due to a shortage of contrast solution which is needed for some medical imaging. Supply chain issues triggered by Shanghai's COVID lockdown are being blamed for the shortage. The situation isn't expected to be resolved until the end of June. Dr Sanjay Jagannathan is president of the College of Radiologists and joins us now. Welcome to you. How would you describe the situation we're now in as a result of this shortage?
Thank you, Kirsten, for inviting me. We consider the situation fairly serious, and the College of Radiologists is working hand in hand with the TGA and the Federal Department of Health to find solutions and to make this difficult situation managed in an appropriate way where patients are not adversely affected.
Well, Queensland Health today announced it is postponing procedures. Are you aware whether other states and territories are now doing the same?
Yes, to a different degree, each and every state is making their own decision. But in that, I would like to point out the postponement is for elective procedures. So anything that is urgent has to be done, because at the end of the day, patient care is foremost, and we are all highly trained specialists who are out there to look after the patients. So any urgent procedures will be done as usual.
What type of procedures would you include in that category as urgent?
Anyone who is suspected of having acute stroke or an aortic dissection where the major blood vessel is suspected to have ruptured, or high-level trauma are instances where we will have to take immediate action, and we will do so.
That does, however, leave quite a few other patients with still facing potentially serious diagnoses waiting for these tests.
Yes, and for all of them, we have informed all our radiologists across Australia how to manage them in an appropriate way. We have advised them, in most instances, we could give the clinical answer the medical practitioner is looking for by doing the scan without injecting the dye. So we will still be able to provide solutions to the various specialists and also the general practitioners who refer the patients to us.
Supply chains and logistical issues have been a huge issue for so many sectors over the past couple of years now. Are hospitals and the medical sector suffering shortages of other products, medicines or treatments also?
From time to time, we have had minor issues with supply chains, but none of them have been as dire as this.
Do you think enough attention has been paid to ways to overcome the obvious logistical challenges we are seeing as a result of the pandemic, and we've known about now for a couple of years?
Yes, in this instance, I must say that the Department of Health, the federal government, and also TGA have really been very collaborative, trying to find solutions, and we are very hopeful that we will be able to get appropriate stocks in the coming weeks.